5 subtle signs an elderly person may be in their final year. Important warnings overlook. Have you ever noticed a small change in someone you love, a parent, a spouse, or a close friend, and wondered if it's just part of growing older? Maybe they seem a bit more tired, or their appetite isn't what it used to be. It's easy to brush these things off, thinking they're just the natural course of aging. But here's something I've learned, and it's a truth that can change how you care for those closest to you. The body often sends quiet warnings, sometimes a year or more before life reaches its final chapter. These signs can be so subtle that we miss them, only realizing later that they were there all along. If you're over 60, or caring for someone who is, this is a conversation that can make a world of difference. As we age, we tend to assume that decline happens suddenly. One day everything's fine, and then it's not. But the reality is, our bodies are always communicating, giving us clues about what's happening inside. Recognizing these clues early doesn't just help you prepare practically, it gives you the chance to fill those precious days with love, comfort, and meaningful moments. Today, we're going to walk through 5 subtle signs that an elderly person might be in their final year of life. By understanding these signs, you'll be ready to make every moment count, ensuring your loved one's final stage is filled with dignity and peace. Let's start with one of the earliest and most common signs: significant weight loss. Unintentional weight loss is a red flag, especially when it happens without any change in diet or exercise. This kind of weight loss isn't just about appearance, it's a sign that something deeper is going on. The body might not be digesting food properly, or it could be struggling to process protein, which leads to muscle weakness. Sometimes, it's tied to a fading sense of taste or smell, which makes food less appealing. Other times, it's a chronic condition like heart failure, kidney disease, or even cancer that's quietly taking hold, long before other symptoms show up. Whatever the cause, the result is the same: less energy, less strength, and a slow decline in health. What can you do? It's natural to want to encourage your loved one to eat more, maybe cook their favorite dishes or try protein shakes. But if the weight keeps dropping despite your efforts, it's a sign that the issue isn't just about food. Forcing big meals might cause discomfort or stress. Instead, focus on small, easy-to-eat foods they enjoy, like soups or smoothies, and make sure they're staying hydrated. Let's move to another sign that often creeps up slowly but speaks volumes: extreme fatigue and weakness. This isn't the kind of tiredness you feel after a busy day or a poor night's sleep. It's a deep, heavy exhaustion that lingers, making even the simplest tasks feel like climbing a mountain. You might notice your loved one struggling to get out of bed, taking longer to cross the room, or needing to sit down after just a short conversation. This fatigue comes from the body conserving its energy as organs begin to slow down. The heart doesn't pump as strongly, circulation weakens, and muscles get less oxygen. Metabolism shifts, redirecting energy to essential functions instead of movement or activity. What's heartbreaking is the emotional toll. For someone who's always been independent, this weakness can feel frustrating or even embarrassing. They might pull back from social events or hobbies, not because they don't care, but because they just don't have the energy. Instead, let them rest when they need to, and focus on creating moments of joy that don't demand too much, maybe a quiet chat or listening to their favorite music. If you're seeing this kind of ongoing tiredness, it's a sign that their body is changing. Now, let's keep going, because there are a few more signs that can help you understand what's happening and how to make the most of the time you have. Let's start with a change that can feel especially personal: increased confusion or withdrawal. Picture this: someone who's always been sharp and quick-witted starts forgetting little things. Maybe they repeat a story, struggle to follow a conversation, or seem lost in a place they've known for years. At first, you might think it's just a senior moment, something we all laugh off. But when these moments become more frequent, or when your loved one starts pulling away from the people and activities they love, it's more than forgetfulness. This kind of change happens because the brain, like any organ, needs oxygen and nutrients to function. As circulation weakens and blood flow slows, the brain starts to struggle. You might see moments of clarity followed by sudden confusion, almost like their mind is flickering. Emotionally, it's even tougher. Your loved one might stop talking as much, avoid social events, or spend hours in silence, not because they don't care, but because their brain can't handle the effort of engaging. They might seem irritable, anxious, or even unusually calm, detached from things they once loved. It's not a personality shift, it's the brain adjusting as the body winds down. Speak gently, keep things simple, and let them feel your presence, even if they don't respond. If you're seeing more confusion, forgetfulness, or withdrawal, don't brush it off. It's a sign that their mind and body are preparing for a transition, and your patience can make all the difference. Now, let's talk about a physical sign that often goes hand in hand with these changes: frequent infections and slow healing. You might notice that your loved one, who used to bounce back from a cold in a few days, now seems to catch every bug that's going around. A cough lingers, a small cut takes weeks to heal, or they're dealing with one infection after another, maybe pneumonia, a urinary tract infection, or even a skin issue. This happens because the immune system weakens as the body nears its final stage. It can't fight off infections as effectively, and even antibiotics don't work as quickly as they used to. Poor circulation also plays a role. When oxygen and nutrients don't reach tissues properly, wounds heal slowly, and bed sores become a real risk for those who move less. What's tricky is that infections in seniors often don't look like you'd expect. Instead of a fever, you might see them acting more tired, confused, or refusing to eat. If you're seeing these patterns, repeated illnesses, slow healing cuts, or sudden changes in behavior, it's time to pay attention. While it's natural to want to treat every infection aggressively, there comes a point where the focus shifts to comfort. Keep their skin clean and moisturized, make sure they're hydrated, and reduce stress on their body. Simple things, like helping them change positions or ensuring they have soft bedding, can prevent sores and infections. These steps don't cure the underlying decline, but they help your loved one feel better day to day. It's a big one, and it's often the most visible as the final stage approaches. Let's keep going, because understanding these signs is about creating moments of love and peace. It's not easy to face these changes, but by noticing them, you're opening the door to making every day with your loved one as meaningful as possible. We've got one final sign to explore, and it's one that often becomes the most noticeable as the end draws near. Let's dive into the last sign: major changes in breathing and circulation. You might start to notice that your loved one's breathing isn't quite the same. Maybe it's slower or more shallow, or there are moments when they seem to pause between breaths. Sometimes, you might hear a pattern called Cheyne-Stokes respiration, where quick, deep breaths alternate with long pauses. These changes happen because the heart and lungs are working harder to keep up. As circulation weakens, blood flow prioritizes vital organs, leaving hands, feet, and even the nose or ears feeling cold to the touch. You might see their skin looking pale, bluish, or mottled, especially around the fingers and toes. Shortness of breath can creep in, even with small movements like turning over in bed or speaking for a few minutes. Some people start breathing through their mouth more or need to pause to catch their breath. Fluid buildup in the lungs can also cause a persistent cough, gurgling sounds, or a tight feeling in the chest. For families, these changes can be frightening. It's natural to want to urge them to breathe deeper or worry that something urgent is happening. But often, this is just the body's way of conserving energy as it prepares for its final stage. You can't always stop these changes, but you can make your loved one more comfortable. Keep their room cool, use a humidifier to ease breathing, or offer small sips of water to keep their mouth from feeling dry. Sometimes, propping them up with extra pillows or helping them sit in a recliner can make a big difference. If you're seeing these signs, changes in breathing, cold extremities, or a bluish tint to the skin, it's a signal that the body is slowing its pace. Over the past few minutes, we've explored 5 subtle signs that an elderly person might be in their final year: losing weight without trying, feeling deeply tired no matter how much they rest, growing confused or withdrawn, battling frequent infections, and experiencing changes in breathing or circulation. These aren't just random changes, they're the body's way of telling us it's preparing for a transition. It's hard to watch someone you love go through this. Instead of trying to reverse the inevitable, focus on what brings them comfort and joy. Maybe it's sharing a quiet moment, looking through old photos, or just sitting together, letting them know they're not alone. By recognizing them early, you can make thoughtful choices, like ensuring they have the care they need or creating memories that you'll carry with you. If this video has been helpful, please give it a thumbs up and hit that subscribe button so you don't miss more insights for caring for yourself and those you love. I'll see you in the next video.